It's 2 a.m. You're watching your baby sleep. Their chest is rising and falling in that peaceful rhythm that finally lets you relax. And then it stops. 5 seconds, nothing. 10 seconds, still nothing. Your heart is in your throat. You're about to reach down and shake them awake when suddenly they gasp, a big breath, and they're breathing normally again like nothing happened. You stand there shaking, wondering if you just watched your baby almost die, or if this is normal. Or if you're losing your mind from sleep deprivation. Here's what I need you to understand. What you just witnessed has a name. It's called periodic breathing. And it's happening to millions of babies right now tonight, while their parents stand over cribs in the dark, terrified, with absolutely no idea what they're looking at. So let me tell you exactly what's happening inside your baby's body when their breathing stops. And more importantly, when you should worry and when you shouldn't. Let's start with what periodic breathing actually is. In medical terms, it's a breathing pattern where a baby breathes normally for a period, then pauses for 5 to 10 seconds, sometimes up to 15, then resumes breathing, often with a few quick breaths to catch up. This cycle can repeat multiple times throughout the night. It's most common in the first few months of life, especially in premature babies, but it can happen in full-term infants too. And here's the part that shocks most parents. It's completely normal. It's not a malfunction. It's not a warning sign. It's your baby's respiratory system doing exactly what it's designed to do at this stage of development. But why does it happen? To understand that, you need to know how breathing is controlled. In adults, breathing is regulated by a part of the brainstem called the respiratory control center. This center monitors the levels of oxygen and carbon dioxide in your blood. When carbon dioxide rises, the center sends a signal to breathe. It's automatic, you don't think about it, your brain just does it. But in babies, especially newborns, this system isn't fully mature yet. The respiratory control center is still developing. It's still learning how to respond to changes in blood chemistry. So sometimes the signal to breathe gets delayed. The pause happens. Then the system catches up, realizes oxygen is needed and triggers a breath. Think of it like a thermostat that's still being calibrated. An adult thermostat responds instantly when the temperature drops. A baby's thermostat has a slight delay. It works, it's just not as finely tuned yet. And that delay is what creates the pause. Now here's where it gets more specific. There are actually different types of pauses in infant breathing, and knowing the difference is critical. Periodic breathing is characterized by pauses of 5 to 15 seconds with normal breathing in between. The baby's color stays normal. They don't turn blue, they don't look distressed. They just pause and resume. This is normal. But there's another pattern called apnea. Apnea is a pause that lasts longer than 20 seconds, or a shorter pause that's accompanied by a change in color, heart rate dropping, or the baby going limp. This is not normal. This requires medical evaluation. So the length of the pause matters. The baby's appearance during the pause matters. And this is why I'm going to give you very specific guidelines in a moment about what to watch for. But first, let me tell you why periodic breathing is actually more common than most parents realize. Research published in pediatric sleep journals has found that periodic breathing occurs in up to 75% of premature infants and about 25 to 40% of full-term newborns. That means if you have a newborn, there's a decent chance this is happening even if you haven't noticed it yet. Most parents don't see it because they're not watching their baby sleep every second of the night. But if you are watching, if you're one of those parents who can't stop staring at the monitor or standing over the crib, you're going to see it. And it's going to scare you, unless you know what you're looking at. Now let me explain the developmental timeline, because this will help you understand when periodic breathing is expected and when it should be decreasing. Periodic breathing is most common in the first 2 months of life. This is when the respiratory control center is most immature. By 3 months, it starts to decrease. By 6 months, most babies have outgrown it. Their respiratory system has matured enough that the pauses become rare or stop entirely. If your baby is older than 6 months and you're still seeing frequent periodic breathing, that's worth mentioning to your pediatrician. Not because it's necessarily dangerous, but because it might warrant monitoring. Here's another factor that affects periodic breathing. Sleep state. Babies cycle through different stages of sleep just like adults. There's active sleep, which is similar to REM sleep in adults. And there's quiet sleep, which is deeper. Periodic breathing happens most often during active sleep. This is the stage where you see the baby's eyes moving under their eyelids, where they might twitch or make little noises. During this stage, breathing is naturally more irregular. So if you notice the pauses happening during periods when your baby seems more active in their sleep, that fits the pattern. Now let's talk about what makes periodic breathing worse. There are certain conditions that increase the likelihood or frequency of these pauses. Premature birth is the biggest one. Babies born before 37 weeks have less mature respiratory systems. The earlier the birth, the more common periodic breathing is. Anemia, which is low red blood cell count, can also increase periodic breathing because the blood isn't carrying oxygen as efficiently. Upper respiratory infections, even mild ones, can trigger more pauses because the airways are partially blocked. And interestingly, being too warm can increase periodic breathing. Overheating affects the respiratory drive. This is why safe sleep guidelines emphasize keeping the room cool and not overbundling babies. You want the sleep environment to support stable breathing. Room temperature between 68 and 72 degrees Fahrenheit is ideal. One layer more than an adult would wear is the rule. Now here's the part where I need to be very clear about when to seek help. I've told you that periodic breathing is normal, but there are red flags that mean you need medical evaluation immediately. If the pause lasts longer than 20 seconds, call your pediatrician. If your baby turns blue or pale during a pause, that's an emergency. If your baby goes limp or seems unresponsive during or after a pause, call for help. If the pauses are accompanied by choking, gagging, or obvious distress, get evaluated. And if you ever have to stimulate your baby to get them to start breathing again, if you have to shake them or pick them up to restart their breathing, that needs to be reported to a doctor. These are not periodic breathing. These are apneic events that require investigation. Now let me give you some practical guidance for what to do when you see a pause that seems long but your baby looks fine. First, count the seconds. It feels like forever, but count. 1 Mississippi, 2 Mississippi. Most pauses that feel like 30 seconds are actually 8 to 10. Second, watch your baby's color. Are their lips pink? Is their face normal color? If yes, the pause is likely benign. Third, watch for the catch-up breaths. After a pause, does your baby take a few quick breaths and then settle back into normal rhythm? That's the classic periodic breathing pattern. And fourth, resist the urge to intervene immediately. I know every instinct is screaming at you to pick them up, to shake them, to do something. But if the pause is under 15 seconds and your baby looks fine, let it resolve on its own. Constant intervention can actually disrupt their sleep and doesn't help the respiratory system mature. That said, trust your instincts. If something feels wrong, if your gut is telling you this isn't normal, get it checked. You know your baby better than anyone. Now let's talk about monitoring. Some parents ask about using breathing monitors or pulse oximeters at home. Here's what the research says. For healthy full-term babies without risk factors, home monitors are not recommended by the American Academy of Pediatrics. They can cause more anxiety than reassurance because they often have false alarms. But for premature babies, babies with diagnosed apnea, or babies with other medical conditions, a doctor may prescribe a monitor. If your pediatrician recommends one, use it. If they don't, and your baby is healthy, the anxiety from false alarms often outweighs the benefit. Here's what most parents don't know. Your baby's respiratory system is going to mature on its own timeline. There's nothing you can do to speed it up. This isn't something you can train or fix, it's developmental. The neurons are forming connections. The chemical sensors are calibrating, the feedback loops are tightening, and that process takes weeks to months, but it does happen. By 6 months, the vast majority of babies have completely stable breathing patterns. The periodic breathing phase ends, and you'll find yourself months later barely remembering how terrifying those pauses used to be. So the next time you're standing over your baby's crib at 2 in the morning and their chest stops moving, remember what's actually happening. Their respiratory control center is still learning. The pause is a delay, not a failure. As long as it's short, as long as they look fine, as long as they resume on their own, you're watching normal development. You're not watching your baby struggle. You're watching them grow. And if this explains something that's been keeping you up at night, literally subscribe to this channel. Drop a comment and tell me if you've experienced this. How old was your baby? How long were the pauses? I'll reply to every comment. And if you want to understand why babies cry harder the moment they see you after you've been gone, that's the next video.